Good day. It is February 3rd today. And what that means is Valentine's Day is just a couple weeks away. I hope you have something exciting planned for your partner or spouse or loved ones. So it's about 11 days away, about a week and a half. So I thought it'd be a great idea today to talk, to kind of stimulate some ideas to help your partner out. Uh, some present ideas or gift ideas would be to get rid of their headache if they have headaches, and assuming that you aren't the cause of their headache. Um, Headaches affect a lot of people. Some, depending where you look, stats say up to about half the population. Some say a little bit more than that. Some I've read up to 80%. There's many different kinds of headaches. One kind that we're going to talk today about, though, is what we call cervicogenic headaches, headaches that are derived from the neck. And these affect about 1 in 10 to about 1 in 4 people, depending again what stats you look at. Um, and these can be really common after accidents, after injuries, sometimes having a previous history of trauma. If you're a boxer or if you've fallen and hit your head, been in a car accident, played a type of sport where you hit your head, these can oftentimes cause these neck traumas or neck injuries that can lead to these types of headaches. Um, so first, I'm going to go over a little bit of the pathology of why these occur, and then the different things that you can do to let your partner and help your partner have less of these headaches, or if yourself, of course, have less of these headaches. So the pathology essentially is the nerves in the upper part region of the neck. They travel in through the spinal cord, and then they meet into what we call the trigeminal cervical nucleus. Basically, it's a bundle of nerves in through the spinal cord brainstem region. And the trigeminal nerve also, as the name suggests, trigeminal cervical nucleus. If the trigeminal nerves and these neck nerves or cervical nerves, they meet in this area. And there's going to be some type of miscommunication or misregulation in this region that can cause pain signals to travel both to and or up and down these nerve bundles. So pain coming from the neck can travel up into the trigeminal cervical nucleus and then can be felt along that trigeminal nerve. The trigeminal nerve essentially provides the sensation to different regions of our head. So that can oftentimes be why you feel oftentimes a pain, top part of your neck right in through here, sometimes a little lower, sometimes a little higher. But oftentimes it's going to be here. It's going to be kind of one-sided. Sometimes it affects both sides, but oftentimes it's one-sided. And then sometimes it'll kind of radiate up like that. Sometimes it comes along like this. Sometimes you feel the pain here, and then the pain also builds up through here. Sometimes it'll feel like it's right behind your eye. It can be quite unpleasant. This type of problem affects women more than it does men. Typically, it's going to affect women that are in their 40s. That's the average age at which it starts affecting people. And again, it's oftentimes after some type of trauma or injury, car accident, perhaps an accident you've had years ago and didn't get rehabilitated fully, or you're having persistent problems since then. There's going to be some tenderness, stiffness in your neck. Typically, um, moving your neck around kind of aggravates it or agitates it. So oftentimes people will be really stiff. They'll be kind of like this. They don't let their head kind of move freely. There oftentimes be moderate to severe amount of pain in the neck. And the more that neck pain builds up, the more the headache builds up. Sometimes there'll be a low grade neck pain, but then if the neck flares up, that'll start and kind of trigger that headache. Um, this can sometimes last a couple hours. Sometimes I've had patients where it lasted weeks until they get that effectively managed. Um, so, yes, a couple different things that people can do for these kind of problems is one, if there is a history of trauma, again, chronic, so a long history of trauma, like years ago, not an acute problem, but something that's happened a long time ago. Uh, there's oftentimes going to be a lot of postural issues that are contributing to this. So oftentimes when people have neck pain, they kind of hunch forward like this. That causes a lot of tension and strain in through the upper back region and in through the neck and causes a lot of tension and tightness. Trigger points in through the neck musculature. and restriction in through the joints, and that's going to perpetuate this issue. So stress can oftentimes trigger this as well. If people are stressed or sitting at a desk all day, or they're just stressed to the max or doing this a lot, that's going to agitate things. So trying to get your partner less stressed will be helpful. Think of cleaning the house, or cooking for them, or doing their laundry, or, being nice. Do something nice for them. That'll help with their stress levels. Sometimes some soft tissue care, some soft tissue therapy, some stretches in through the neck and upper back region can be very gentle. Being very gentle can be quite helpful. And so consider giving them a neck rub or upper back rub. That'll feel pretty good, and it'll help alleviate a lot of that tension. Oftentimes, we'll get people doing like trigger point therapy, essentially taking like a tennis ball or kind of their finger, and they'll press it right into these muscles right at the top of the neck. That'll help them relax and start to subside, and that will help reduce the amount of pain traveling into that trigeminal cerviconucleus, and less pain radiating into that trigeminal nerve, and less of a headache essentially. Be careful though. Sometimes some people doing those things actually agitates it. So knowing what works best for each person is very important. So we don't do things that are going to obviously make that headache worse. Um, Different things we can do as well. Oftentimes, people with these kind of headaches, they have weak neck musculature. So the muscles in the front of the neck become a little weakened. And this creates a perpetual cycle where it's easier for the neck muscles in the back to become agitated and thus cause this headache, which then can contribute to the neck's muscles in the front getting weaker again. It's really important to rehabilitate those front neck muscles with some deep neck muscle exercises, some isometrics as well. So getting on a bit of a rehab program with that will oftentimes be quite helpful. Uh, and you're also going to find several trigger point in the different muscles in the neck. So in the back here, oftentimes in the sternocleidomastoid, this muscle right in the front here, oftentimes in the traps, that will also elicit that headache. So digging in on those trigger points can be quite helpful. And of course, taking them to your local chiropractor so they're able to perform a manipulation into their upper back and neck region. That I find is one of the best therapies for people with this type of headache. If you have any questions, concerns about any of these issues, feel free to reach out. Um, Hopefully, you're able to help your partner have less of these types of headaches and help them feel significantly better. If you are able to do that, congratulations. And you're very welcome on the idea. Have a fantastic rest of your day, and we'll talk to you soon.